Hitting the lottery is absolutely great, but having excellent health is even better. Patients with untreated sleep apnea often don't dream. They don't go into all the different stages of sleep, which is a problem. But the greater issue with untreated sleep apnea is all the comorbidities. Patients with untreated sleep apnea may develop high blood pressure, stroke, irregular heart rhythm, poor control of diabetes, even dementia and weight gain. And when you treat the underlying obstructive events, patients' health improve, which is the main goal. When patients come to a sleep center, sure, we see many patients with underlying sleep apnea, but oftentimes we have to evaluate patients who have sleep onset insomnia, sleep maintenance insomnia, narcolepsy patients, restless leg syndrome patients, patients with shift work sleep disorder. So there's quite a varied population of patients who do come to the sleep center. When patients are referred for an inpatient polysomnogram, they come to Saline to the sleep center. And here we have inpatient beds with different channels to evaluate the different stages of sleep and whether somebody's oxygen level falls, whether or not their heart has an arrhythmia or a regular rhythm. And it's about a 18-channel polysomnogram. And so the patients who are excellent choices for inpatient polysomnograms are patients who have underlying high blood pressure, congestive heart failure, COPD, underlying comorbidities. When a patient doesn't necessarily have underlying comorbidities, we'll schedule a home sleep test. And Saline actually does a very good job with their home sleep test. At Saline, a patient will be referred for a type 2 home sleep test, which I think is great because with a type 2 home sleep test, the patient will have EEG leads. So you can actually tell whether or not the patient is truly sleeping. Many sleep centers would do a type 3 home sleep test without the EEG leads, and so you don't really know if the patient's asleep. And that's kind of the goal, to know what the patient is doing while sleeping. There are many different ways to treat underlying sleep disordered breathing. Surgical intervention can be performed. The dentist can make oral appliances. There's a new treatment out now called Inspire, where they make a small incision in the chest and advance a wire to the hypoglossal nerve of the tongue. But in general, the gold standard is simply treating with CPAP therapy, which is basically continuous positive airway pressure. And the goal is to find the lowest pressure possible to treat the obstructive events. And so you can manage different masks, different pressure, humidification, and just make the entire process as easy as possible for the patient. We really appreciate the opportunity to care for patients here at the Saline Memorial Sleep Center. It's very rewarding for not only myself, but the sleep technicians, the nurse practitioners, everybody involved. And I feel that we really do a great job. I love the techs. I love all the people who contribute. And hopefully we can do you some good.